And in this session, what I would be dealing is, because instead of going in detail about the all the textual informations, what I will try to do is that I would be giving the clinical scenario, how exactly in clinical setup, how it is being diagnosed, and what are the various factors that need to be considered. And also the algorithm of treatment of various therapies, various medications, and how exactly you can plan for the treatment, and what stage at which you can say that this is not my cup of tea. That is also very important to know. That means to say that the prognosis, we have to very carefully, we have to observe the patient and we have to understand the prognosis in certain conditions. So let us begin with today's presentation. 2022, this article has been published and entitled Facial Palsy as a Manifestation of COVID-19, a Systemic Review of Cases. So in this article, the authors have given a very clear verdict that they have gone through various studies, like 49 studies, bearing accounts of 75 cases who had facial palsy. And ultimately, they could come to certain conclusion, saying that there is a relation between this COVID-19 and facial palsy. And ultimately, in the conclusion, what they finally have given the verdict is that the association of facial palsy with COVID-19 is controversial and therefore requires further investigation and published work to confirm a causal relationship. However, physicians should not overlook the likelihood of facial palsy post-COVID-19 infection and treat it accordingly. So this article gives a whole picture, is that whatever we have understood all these days as the causative factors and various organisms which can cause this kind of the clinical condition. Apart from that, also there are so many things which we did not know, and slowly but steadily we are going to get some more information about this. And one among that is this COVID-19. And COVID-19, of course, you know that the COVID-19, after the COVID-19, there are so many people who had the issues related to the heart, issues related to the cerebrovascular system. So one among that is this ardita or facial paralysis. Now, everyone knows about this, so I need not elaborate all these things, I believe. But very importantly, some of the signs and symptoms, the cardinal feature of ardita vata, which is being explained as vakri karoti, vaktrardham uttam, and kampate murdha vaksangam, stabda netrata, danta chalaha, swara bramshaha, shruti hani, shavagraha, jatudva, ruja tivra, sharira ardha, adare piva. There are different varieties of symptoms, various symptoms related to that of the sensory involvement, to that of the motor involvement. There are different varieties of symptoms are explained. When I am speaking about this, probably most of the people, when I utter this word of ardita, probably most of the people might have understood that this presentation would be all about the facial paralysis. But looking at the signs and symptoms which are given in the various texts, you can also say that this is not only confined to that of the facial involvement, including the signs and symptoms like gandha jnanam, smrite moha, trasaha, suptasya jayate. So there are different varieties of symptoms, even the sensory system is also involved. Now, when we correlate this ardita vata to that of the Bell's palsy, what are the signs and symptoms of Bell's palsy? Everyone is very much clear about this one. The incidence of Bell's palsy, it is generally been considered as a lower motor neuron lesion, and it is a Bell's palsy is around 20 to 30 cases per 1 lakh people per year. It is seen, accounting to 60% to 75% of all unilateral facial paralysis. And up to 30% of the patients develop long-term sequelae, where it is a very important issue that need to be addressed as early as possible. This shows the urgency of treatment in case of ardita. And of course, everyone knows about all these things. I'm not going in detail about all these things, but you need to concentrate on certain factors, that is causes. As far as the contemporary science is concerned, when we are speaking about facial paralysis, the causes may be diabetes also, the hypertension also, and injury, sarcoidosis, and Guillain-Barré syndrome, myasthenia gravis, etc. Now, once we know about all these things, the differential diagnosis is very important. We may not think, when we speak about the Bell's palsy, most of the times what we say is that it is idiopathic. So there is no reason why the facial paralysis has happened, or otherwise we do not know. That is the outline what they have given. And based on that, definitely they have made it as a part, or the cause is not known. But there are many known causes are there. These causes can cause or manifest into a facial paralysis, or sometimes it is a facio-brachiocrural hemiplegia, which involves the face, the one part of the body, especially the limbs. It is an involvement of upper limb and lower limb, either the right side or left side. It may be ipsilateral or contralateral. So it is very important and necessitated to understand what are the differential diagnosis of this Bell's palsy, where it is very importantly, they have categorized into the central nervous system involvement, where the stroke and space-occupying lesion, distinguishing characters, you can see that it is a forehead sparing and headache and limb weakness and multiple neurological signs. Autoimmune disorder like Guillain-Barré syndrome. Generally, Guillain-Barré syndrome, it is a kind of the disease which is an ascending kind of the weakness is seen. So it is a post-viral demyelinating polyneuropathy, which is the ascending kind. But there are rare conditions where this could be a descending kind also, where the cranial nerves are involved. And in certain conditions, even the facial nerve is also involved. So in general, it is an ascending kind of weakness, and absent of reflex is there, where the lower motor neuron lesions are seen. But the thing is that in certain cases, very rarely it is a presentation is descending kind also, where the cranial nerves are involved, in which facial nerve is an important one. Other causes like multiple sclerosis, where upper motor neuron signs are there and abnormal cerebrospinal fluid is being seen. Metabolic disorder, this is most of the times we do neglect this one, is that the diabetes, where you see that the increased blood glucose is there, but the thing is that patient lands in the facial paralysis. Most of the times, though, we cannot correlate directly this cause into that of the manifestation of this palsy. But having said that, this is one of the very important causative factors. Apart from this very important one, most of the times we do not think is that infectious diseases like meningitis, herpes simplex, Lyme's disease, and even the Ramsay-Hunt syndrome. So this Ramsay-Hunt syndrome, which has been caused by the varicella zoster, which is almost, most of the times it has been overlooked by the Ayurveda practitioners. So it is the distinguishing character of this one is that pain and vesicular eruptions. And also very important issue is that granulomatous diseases like sarcoidosis and neoplasm, like parotid tumor and facial nerve tumor metastasis are also very important causes for this the facial paralysis. Now, very importantly, did Ayurveda talk only about the facial paralysis in the name of Ardita? That is what is the question generally comes to the mind of an Ayurvedic physician. Charak Samhita talks very high about the Vata Vyadhi in 28th chapter, where he explains about Ardita. The explanation of Ardita says that this Ardita is not very much similar to that of the routine presentation of the Ardita, what it is been explained by other great scholars of Ayurveda. Here he speaks about facio-brachiocrural hemiplegia. So this is one of the very important thing that we need to consider. So that shows that the facial paralysis both can be manifested as a UMN lesion originated or otherwise LMN lesion originated. So both of them definitely we have to bifurcate. So now, as we know the causes, in that we have to bifurcate what is peripheral, what is central. In the peripheral, generally it is a Lyme's disease, otitis media, Ramsay-Hunt syndrome, sarcoidosis, or Guillain-Barré syndrome, and a tumor are especially in the tumor, there are different tumors which are among them. Cholesteatoma is one of the very frequently found the carcinoma. So that generally, produces the symptom like a peripheral. So lower motor neuron lesion will be seen. Where supranuclear, that is a central one, is a multiple sclerosis, a stroke, and a tumor. So these are very, very important one. So these are the pictorial, bifurcation, how exactly you can just bifurcate as far as the clinical presentation is concerned. The central type, the function of the forehead and eyebrow remains normal, whereas the disappearance of a nasolabial fold and drooping of the lower lip is seen, especially in case of central type, whereas peripheral type, there is a dysfunction of the forehead and eyebrows, and the incomplete closure and drooping of eyelid is seen, whereas the disappearing of a nasolabial fold and drooping of lower lip is also seen. So this is how bifurcation practically, the clinically, you can just play and think about. But now, Ayurveda point of view, when we search these all things, there are so many the causative factors which are explained in the contemporary science. And we have said it is only Ardhita, which is a central variety of Ardhita and peripheral variety of Ardhita. Both the explanations are there. But there is one more interesting variety which has been explained in the Ayurveda is also very, very interesting is that Swastha Syad Ardhitanam Muhur Vega Gate Gate. So he says that there's a Vega, whenever it is a Vega is seen, so it is like a transient period, you will have kind of the presentation of a facial paralysis or facial-brachiocrural hemiplegia kind of presentation is very much possible. That's the reason why he said that there are different disorders in which it is a transient period is there. So it is a Vega. So it is a variety of Vega. So then variety of Vega, is it not being told in contemporary science? When we look for some of the evidences related to that of this kind of this variety of presentation of the facial paralysis, we do find some of the articles which are published, very interesting article, like a transient facial nerve paralysis, Bell's palsy following intranasal delivery of a genetically detoxified mutant of Escherichia coli, Peter labile toxins. So that shows that the nasal microbiome, once it is being changed, then there is a chance of the presentation of neurological signs and symptoms. So this is very much evident with this variety, this kind of the article. Now, nasal microbiome is a very, very important one for the healthy person. And there are extensive researches which are conducted on the benefits of targeting this nasal microbiome. It is similar, as everyone knows about this, that gut microbiome is being more talked about, but this nasal microbiome, very least time we do utter this word of nasal microbiome. But this particular article shows that whenever it is being destructed, the normal nasal microbiome is destructed, there is a chance of presentation of various neurological disorders. This is one among them. The Bell's palsy presentation is there. That is also the transient variety. However, other articles are also there, micrological finding of acute facial paralysis in children. So in this study, they have found that many of the organisms definitely do come into picture as far as the presentation of these kind of the neurological diseases. One among them is Bell's palsy. So it is very much evident that there are different varieties of presentations are there, different varieties of causes are there. So to sum up, it is a very important one to sum up all these things: neurological one, Guillain-Barré syndrome, multiple sclerosis, pseudobulbar or bulbar paralysis, traumatic, one of the very important thing. Most of the times it has been overlooked. Person have met with a road traffic accident, comes with a facial paralysis, maybe a minor injury, but head injury is there. In that condition, generally, you do not, in the initial stage, you do not get some kind of idea about this. Similarly, the trauma, especially parotid surgeries, immediately after the parotid surgery, post steroid surgeries are there. So in these conditions, there is a chance that because of the trauma to the facial nerve, there are chances of the facial paralysis. And infections like post-influenza infection, mononucleosis, HIV infection, Lyme's disease, syphilis, all those things we have discussed about this. And in metabolic, neoplastic and autoimmune and idiopathic. So these are the various varieties of the presentations, the causes for the facial paralysis. One among them is a very important and interesting one is that the Ramsay-Hunt syndrome. These are the symptoms of this, especially Ramsay-Hunt syndrome. This has got three different varieties, first, second, and third. So this second variety, so it comes herpes zoster oticus. So it is also varicella zoster infection. Causes all these things like the presentations would be with dry eyes and it is tinnitus, vertigo, and hyperacusis and painful ear rashes, nausea, and facial paralysis. So these are the presentations, especially with the patient, you can just see all those presentations are seen with this. One more interesting and very rarest condition, which also need to be ruled out. This is a syndromic presentation, like 2-3 different kind of the symptoms are seen, like a Melchior-Rosenthal syndrome. So it also known as the orofacial granulomatosis and idiopathic neurological disorder, and where the non-tender persistent swelling of one or both the lip is seen, and facial paralysis, and lingua plicata that is fissured tongue is also seen in this presentation. However, some of the articles which are published where it has been shown that Bell's palsy, which has been misdiagnosed many of the times, where the involvement of the carcinoma and or the presentation or the manifestation or the pathology of the carcinoma is being neglected in many of the studies. So that is a very clear version which is being given. Now, in order to grade this, it is a very important grading system which is there, which is known as House-Brackman facial nerve grading system, where it says that no paresis and normal function is first grade, and the second grade is mild paresis, no deformity at rest is second, third is moderate paresis, fourth is moderately severe paresis, fifth is severe paresis, and sixth is complete paresis, atony at rest, no active movement. So this is a very important and you need to understand this very clearly, that what sort of facial paralysis are we coming across, or otherwise can we treat complete if the person comes with the sixth stage, can we treat the patient, or otherwise patient comes in second or third or fourth, is it possible to treat the patient? That is what is the clinical judgment of a physician. So it is a very important, as I said, it is a House-Brackman facial nerve grading system. It is a very, very interesting one and important one as well. Now, before going into the other discussion, what I would do is that I would be discussing about two cases. They are published, and especially one case is of idiopathic Bell's palsy, another one is a case of Ramsay-Hunt syndrome. So in this, we will be quickly going through what are the treatments which are given, so that we will try to understand that how exactly the protocol of treatment can be planned. So the first and foremost treatment which is being given is Sthanika Ardhanga with Prapanjana Vimardana Taila, Sthanika Svedana with the Arkapatra Pinda Sveda, Nasya with the Shadbindu Taila, 4 ml in each nostril. And taping, this is in the later stage, we will discuss about this. Taping was done with the Dynaplast, and mirror exercise was given in the first set. Later on, it is a Sthanika Abhyanga with the Prapanjana Vimardana Taila, Sthanika Svedana with the Balamula Sadhita, Shakti Shalipinda Sveda, Nasya with the Karpasastha Taila with 4 ml in each nostril, and taping and mirror exercise continued. Dhanadhanayana Kashayam and other oral medications are continued in the follow-up Shiropichu and Pratimarshanasya with the Karpasastha Taila and Mahamasha Taila, which has been continued, especially Pratimarshanasya Mahamasha Taila with 1 ml in each nostril. It is been given and it is been continued. Mirror exercise is continued and oral medications are continued. In the initial stage, Dhanadhanenadi Kashayam was there. Later on, it is converted into, or it's been changed to Ashtavarga Kashayam and then Mahayogaraj Gugulu and other the patent drugs are given. Ultimately, patient got very, very important relief in this particular condition because there is a very lengthy follow-up is also being seen. In one of the cases, is this second case, we'll discuss about this first. So one more case which has been published, and in this case is the treatment which has been given is Sthanika Abhyanga with the Prasarini Taila, Sthanika Sveda with the Arkapatra Sveda, and Marsha Nasya with the Shadbindu Taila 4 ml in each nostril, Sthanika Abhyanga with the Karpasasthyadi Tailam, and Sthanika Svedana with the Shashtimsali Pinda Sveda, and Marsha Nasya with Maharaja Prasarini Taila 4 ml in each nostril. And then other medications are given, and ultimately during the follow-up, the Karpasasthyadi Tailam is given for Sthanika Abhyanga, and Sthanika Sveda was given with the Panasa Patra Sveda, and Shiropichu was advised with the Karpasasthyadi Tailam, and Pratimarshanasya with the Mahamasha Taila 1 ml in each nostril. And then the oral medications are given, the Maharaja Prasarini Taila capsule and Ashwagandha syrup and all those things which are given. And ultimately, the best relief is being observed. Of course, you can see there is a similarity, there is a dissimilarity in these two case presentations. And of course, both of the patient got 100% cure. That is the reason why we have published these cases long back. It is a long back case. Of course, when we talk about the treatment protocol need to be very, very clear. And we need to have algorithm. And the allopathy science gives this algorithm and states that there are only two important treatment that has been very much highlighted and very much clear from their point of view is that the corticosteroid, administration of corticosteroid and administration of antiviral in case of the viral infection is seen, any infection is seen, combat the infection. Whenever it is seen that it is autoimmune, talk about give the corticosteroids administration. So this is how the algorithm is being given, and ultimately the failure to recovery ultimately refers to the specialist. That is what is a reference on the thing what they have given. What about Ayurveda? What Ayurveda talks about the treatment? Ayurveda gives various explanations about this one. Among them, very much clear and very much relevant in the practice, as well as most of the people do practice with this background is that Ardite Navanam Murni Tailam Tarpanam Imicha Nadi Sveda Upanahascha Api Anupa Pishitair Hitaha Svedam Snehasayuktam Pakshagate Videtanam. So there is in Charaka's version also this Ardita and Pakshagata, they are explained, the treatment principles are explained one after the other that show that there is a link between these two things. Of course, there are different varieties of treatment principles you do find. Like principles of treatment includes the Kevalam Nirupastam Vitam Madhu, Snehi Rupacharet, all those things you know it. Namani Swarpanishcha, Annehi Sustikdehi Swede Tata Swabhaktam, Snehasayuktam Sankaraddehi Punah Punaha. So here one more extra point which we got. Ardite Navanam Murdi Telam Shotra Akshitarpanam, Sashope Vamanam. So there is one more extra point what we got with this treatment principles where he said that Sashofe Vamanam and Daharaga Yukte Siravadaha. So it is a very clear version from the Ayurveda science is that you need to identify the condition. Most of the times what we say is that facial paralysis is a facial paralysis. Why I explained about many of the conditions, especially highlighting few of the conditions like Ramsay-Hunt syndrome and Melchior-Rosenthal syndrome and such kind of diseases. Most of the times we do neglect and we do not screen the patient, we do not understand the patient, we do not identify the signs and symptoms, and hence most of the times the treatment may not be very fruitful. And that is the version. See, if you see the different Acharya's version, you do find some sort of variation they had. And that variation, probably it is related to that of their keen observation. And that keen observation, most of the times it is related to that of the dosha involvement, and the other principles like Mastishka Shirobasti, Asya, Duma, Upanaha, Sneha, Nadi Svedadvihi, and Tailahinam Kshirasarpi Akshitarpanam Iti. So there are different varieties of treatments which are explained, and especially in the first version, you can see that Udamantam, Ganam, Sheetam, Shofam, Medo Yuto Anilaha Karoti Yasitam Vaidya Shotam Samupachare. That is also comes under this broader purview of understanding of the treatment protocols. When Karnashula is one of the signs and symptom. So there, specifically, Nadi Sveda, Ishtasvedayet, and other varieties of the ear drops are also been explained to be given in this condition. Especially the Dhumapana is also indicated, and Nadi Sveda is being highlighted. So now it is very much interesting and very much essential also to identify the involvement of dosha and what sort of symptoms it can give, and based on that, how the treatment can be planned. So this is how we need to plan, and what way I understand the condition. Of course, it is a Kevala Vata Vyadhi. It is, you may say that it is not having any Avarana pathology or Gatavata pathology or kind of thing. But the involvement of dosha, other doshas, involvement of ama, everything will change the total scenario, and ultimately it produces in a different way. And similar to the signs and symptoms, similar to that of Samprapti, or understanding Samprapti and Samprapti Vigatana should be done based on the signs and symptoms, understanding that the involvement of various signs and various doshas are there. Specifically, the Vata dosha is involved, facial paralysis, stabdata of netra, and pain in the face, and pain in the body also, headache, kampana, and Kshavagraha, Smriti Moha, and Nidra Nasha, Karnashula, Ruksha Jihva, and Shabda Asahishnuta. So this Shabda Asahishnuta is also there. That is also explained in Ayurveda. It is also seen in case of the Ramsay Hunt syndrome in some condition. In case of Pitta, when it is involved, Daha is there, Raga is there, Pidaka is there, Visarpa is there. And Visarpa, when I say Visarpa, it is not exactly the what I'm directly mean to say that Visarpa as a disease. Of course, it is also incorporated. So then we have to understand, see, in case of the Ramsay Hunt syndrome, the herpes zoster is, the infection is there, and based on this point, what we can understand is that the Vata Vyadhi associated with that of one of the another disease that is called as Visarpa, and the treatment has to be done accordingly. Brahma is also one of the symptom of Pitta. Whereas Kapha symptoms like Sukti, Shota, Gandha Ajnana, Gaurava, Rasa Ajnana, and Hrallas and Chardi are various symptoms of this one. So now it is very important to know that what are the algorithm as far as Ayurveda treatment is concerned. So first and foremost thing is that assess the severity of the paresis, and mild to moderate, then assess the dosha. In case of severe to complete also, then also you have to definitely understand the total involvement of dosha, and then based on the dosha, you are supposed to plan for the treatment. It is not a haphazardous treatment. What generally we think that any Vatavadi is there, just as Snehana Svedana has been done, that kind of understanding will not help to identify a pinpointed treatment or otherwise pinpointed medication selection as well. So kapha dosha, when it is involved, or there is a comorbidity like diabetes mellitus or syndrome X, or otherwise, whenever the patient comes to you in the season of Vasanta Rutu, or maybe sometimes to the Hemanta Rutu, in these conditions, definitely the involvement of kapha you are not supposed to neglect. You have to always identify this as an opportunity to treat kapha, or most of the times, whenever in these conditions, you will be having, already we have discussed about signs and symptoms. One point is signs and symptoms. Based on the signs and symptoms, you are supposed to treat it based on the involvement of kapha. At the same time, these are extra points where comorbidities, where the medas is also involved, kapha is also involved, and also syndrome X in that similar condition is there. Kala is also very important, where Vasanta Rutu is there, Hemanta Rutu is there. In those conditions, in case the presentation is similar to that of Kapha, that need to be understood as the involvement of Kapha was there in that, is there in this case. Otherwise, there is a possibility of Sama Lakshana's involvement of Ama is also to be understood very clearly. In that condition, the signs and symptoms related to that of Sarvadahika is there, then Vamana Karma is a first and foremost choice. That is what the Shastra talks about, is the Vamana Karma is first and foremost choice. But this Vamana Karma, there are technical issues in order to conduct this Vamana Karma because of weakness in the facial muscles. There are chances of some sort of complications. That's the reason why you have to, with carefulness, you can plan for this. Otherwise, or after completion of the Vamana Karma, you can plan for Shodhanasya, or otherwise, you can plan directly with the Shodhanasya. In the Shodhanasya, there are different varieties. You may ask me one question, is that, sir, it is told that Navananasya has been explained. Well, why are you planning for other varieties of Nasya like Pradhamananasya and Avapidakanasya and Navananasya? It is very important and very important to know the involvement of kapha, in what intensity it is involved, and what sort of problems it is producing, how much it is producing. So based on that, only the Pradhamananasya kind of medication like Smriti Sagar Rasa and Shwasaputar Rasa and Vachapurna can be done. Avapedakanasya like likes of Vachapitpali, Avapedakanasya or Gudardra also can be done. And the later stage, it is a Navanasya. Of course, Navanasya is one of the very important, where the involvement of kapha is very least and the maximum involvement of vata is there. In that condition, Navanasya is indicated, especially the plan of treatment or in case of kapadosha involvement, Ushnavira Dravya only has to be done. In case of Pitta dosha involvement and Rakta involvement, Ruksha and Stigdha Nityarechana is the first line of management. So when I say about Ruksha and Stigdha Nityarechana, it is maybe understood as the administration of Avipatti Churna or Avipatti Karachurna. You may ask why. Because Pitta and Rakta are Sasneha, and that is the reason why you are supposed to plan for Ruksha in that condition. And in the later stage, you have to change it as a Snigdha variety, like the administration of Nimbamrata, the Eranda Taila. For the first and foremost, the Koshta Shuddhi, that is very important. I will discuss about that point also later. Chalau Kavacharna also is indicated in case of the Visarpa and similar kind of presentation. In case of Pitta dosha, it is not the Shodhananasya, it is a Shamananasya which is being identified, it has to be given. And Shamananasya, or sometimes in the later stage, Brahmananasya also can be given. Specifically, in case of Pitta dosha, Shamananasya should be a Shita Virya Dravya. An example is that the Kshira Bala Taila, when you are planning, that is a right choice of treatment in case of these kind of disorders. In case of Vata dosha, of course, everyone knows that Vata is involved in Snigdha Rechana has to be given. So Gandharvastadi Tailam, or otherwise Mishrakatneha, or otherwise Trivrit Leham. So these kind of medications has to be done for the Koshta Shuddhi, and then you can plan for the Nasya. Nasya is very important treatment in this and highlighted very well. And in case of Vata dosha, Shamananasya as well as Brahmananasya, both of them can be planned. And in the Vata dosha, it is Shamananasya. Again, there are two varieties of the selections are there. It may be a Shita Virya or Ushnavirya, and Brahmananasya also Shita Virya or Ushnavirya. Based on the situation, can just plan. Madhura Rasa and Shita Virya, which is also Brahmana, or Madhura Rasa Shita Virya, which is also the Shamana. That drug can be administered in case of extreme condition. When the patient comes to you with the extreme condition of the climate, like a Grishma Rutu, the person is coming with a very hot climate, like now what is going on. Now, too much of the heat is there, and too much of temperature is increased. In this condition, the patient comes to you, and you may say that Vata is Shita, and we have to plan always for Ushna. But I differ from this observation, and the plan, I would say that the Shita Virya Dravya, it's much beneficial. We'll discuss about that, the selection as well. There is evidence of this one, Sadhya Vamana. Of course, problem with the today's scenario is that people do not come to you in a very instantaneous or very readily. They do not come as soon as the manifestation of this facial paralysis is there, then they will not come. So in that case, it is very difficult to find such cases without undergoing any kind of the oral corticosteroids or oral anti-viral drug therapy. So it is one of the very important article which has been published by Dr. Indu and Dr. Ramya Vijayan from the Tripunatra Ayurveda College. So that they have conducted Sadhyomana, the efficacy, effective management of the Bell's palsy. Case report is there. You can just go through this one. And a very important contribution is that Sadhyomana has been done. Again, let me not elaborate things, but Sadhyomana is indicated whenever Kapapradana Doshanam, Klishtan, Amashisthitan, Jarakaran, Buddhi, Omyanam, Munir, Harit. This is the basic concept where the involvement of the Klishta dosha, Amashisthitu dosha is there. In that condition only Sadhyomana can be done, or otherwise it can also be performed in order to create a conducive environment in the body in order to adopt other varieties of treatment. However, Nasya Yoga, you can see Shadbindu Taila, it is a Navanasya, which is a Ushnavirya, and it is a Kapavata Haranu Taila, it is a Shamanasya and a Mahavasha Taila, it is a Ushnavirya, Vatahara Taila, and Sulpamasha Taila, it is also Ushnavirya and Vatahara Taila, Samisha Mahamasha Taila, Ushnavirya, Brahmana Taila, Prasarini Taila, Ushnavirya, and it is a Vatahara Taila, and Maharaja Prasarini Taila, it is also Ushnavirya, and Shamanavata Shamana Taila, Kshirabala Tailam, maybe Kshirabala Taila, Kshirabala 101, Kshirabala 14, Kshirabala 7, Kshirabala 21, Kshirabala 41, whatever it is there. They are all are Shita Virya, and it is a Shamana variety of drugs which also can be utilized here. Sacharaja Tailam, it is different avartis also can be given. It is not, out of interest, you can just see different varieties of oils you can use, and they are very much beneficial. And then Sachara Tailam, Dhanvantara Tailam, it is Ushnavirya and Atakafara. And then Karpasastya Taila, it is also Vata Shamana Taila. So this also can be utilized. Very importantly, one more point I would like to highlight is that the protocol of Nasya Karma is very important, where the most of the times they say that 7 days you plan for the same Nasya. Is it right? Is there any changes that we can bring about, or otherwise how exactly tailor-made, or particularly to the particular case, how exactly you can plan for some varieties of Nasya? So here are different varieties of protocols are there. Alternate days Brahmana Nasya, because Nasya Karma is not indicated daily as far as the routine practice of Nasya is concerned. This is a classical version. He says that alternate days only, it is not a daily one. So it is an alternate days you are supposed to plan for, and the same can be planned for this Brahmana Nasya alternate days, Brahmana Nasya alternate days, Shamana Nasya, and daily Shodhan Nasya, daily Shamana Nasya, and daily Brahmana Nasya also can be given. Alternate days Shodhan Nasya and Shamana Nasya also can be planned. Alternate days Shodhan Nasya and Brahmana Nasya also can be planned. And daily twice Nasya Karma, which is also been explained in various kind of disorders, which has been explained in Ashtanga Hridaya and Ashtanga Sangraha. But here also, I've tried in many of the cases where it is too much of Vata dominant condition is there, 2 times of Nasya, it is going to be very, very beneficial, because it will also reduce the time of stay of the patient, and it will give a wonderful outcome. Now other treatment, Tarpana, which has been explained as a second in that point, Tarpanam Putapatam cha Nasya Anarhe na yodhayet. In case of Nasya Anarha, it should not be done. So Nasya, whenever you are not doing it, naturally the Tarpana is also should be discarded. Very importantly, the important benefits what he has told is that Shushke Rukshe Abhigati. So Nivati Tarpanam Yojam Shuddhayor Murdhakayoho. So very important version, most of the times we do forget, is that we do not do the Urdhva Shodhana, Urdhva Kaya Shodhana, or otherwise Shuddha of Kaya Shodhana. Both of them we do not do, and we plan for Tarpana. So Tarpana, in any of the reference you take, most of the references, or almost all, it is the kind of Kaya Shodhana and Murdha Shodhana. That shows that the Kaya Shodhana in the form of Vamana and Virechana, or otherwise Murdha Shodhana, at least Murdha Shodhana you can plan for the Shodhana Nasya, and then plan for this one. So that comes, it is a second variety of treatment, second in order treatment. So now algorithm, let us see. assessment of eye closure is there, especially in case of the Bell's palsy. So it is very much it is seen, and that shows that eye closure is inadequate. In that condition, only these kind of treatments are done. Like eye closure measure is essential in that condition. In this, there are different varieties like Ashtotana or otherwise the eye drops administration, and Akshi Pichu Bandhana is also one of the very important. Akshi Tarpana is also indicated, and Akshi Tarpana Putapaka also you can plan for. It is not only the Tarpana what is been explained in the classics that need to be planned, but also other varieties also can be done. Now, very important treatment. Most of the time, most of the people do practice, but there are some confusions still are there among the practitioner is in the form of the Murda Taila or Murdni Taila. So in that condition, based on the dosha, you can plan for. In case of Vata dosha, Shiro Abhyanga, Shiro Dhara, Shiro Pichu, Shiro Basti, and Shiro Upanaha. This is considered as Mastishka. Now, Mastishka, everything is being indicated. So in case of Vata dosha, Shiro Dhara specification is that Dhanyamla Dhara or Taila Dhara can be planned for. In case of Shiro Upanaha, the specification for the Vata dosha is that Ushna variety of Shiro Upanaha can be done. Or in this condition, I would say that Shiro Upanaha and Talapuduchil, there is one treatment which is traditionally done in the Kerala belt, where the incorporation of Shiro Upanaha as well as Shiro Pichu, both of them are there. Done. So it is actually incorporation of two treatment in one treatment. So that kind of treatment also can be done. But in case of Vata, it is Ushna only. In case of Pitta, you can plan for Shirodhara, Shiropichu, and Shirupana. I forgot to tell that Vata dosha, especially Shirobasti, in that direct reference is there the administration of Shirobasti in case of the Ardita. Now, the choice of the Taila in case of Ardita Vata is also very important one to understand is that Kshirabala Taila, Mahanarana Taila, Shitavirya, Mahamash Taila, and Prabhajana Vimardhana Taila, Prasarini Taila, Karpaskar Taila, Shuddhavala Taila, Paranita Kshira Taila, Ketaki Mula Taila. We think that Paranita Kshira Tailam, it is indicated in the case of Vishwachi and above is also indicated. Very beneficial in this case as well. And Ketaki Mula Taila, basically it is indicated in Astika Vata, also indicated here as well. And for Shiro Upana, already I have discussed about the basic concept, Amalaki, Vacha, Tagara, and Pushta, Ashwagandha, Brahmi, Shankupushpi, Rasnadi Churna, Kachoradi Churna, Tripula Churna, Estimati Churna, all these things can be utilized. Now coming back to the usage of Svedana, most of the times the confusion will there in the mind of the physician that what sort of Svedana can be utilized. Most of the times it is invariably every cases you plan for the Kshirodhuma, this is not going to help. So as classical version says that Tapa Sveda is indicated for Vata Kapha and Vishnu Sveda for Vata Kapha and Upana Sveda for Vata and Dhrava Sveda for Pitta. And then Sankara Sveda, especially the Shashtika Sharipinda Sveda, though it is having Vishita Vira Dravya. So it is most of the times in the traditional practice, it is not being used as the Svedana, the Madhyama to Uttama Svedana, but in case of Mrudu Sveda, at the same time they were using it as more sort of a snigdha variety of treatment that in order to nourish the underlying muscles that is being used. So Nyavara Tepu or Nyavara Kidi or the Shashtika Shalipinda Sveda and Analepa, both of them can be utilized similarly. And Arkapatra Sveda, so this is in both the cases I have shown this Arkapatra Sveda. So in this Arkapatra Sveda, the Arkapatras are taken and it has been pasted into a small paste and then it has been made into small bolus and then it has been applied. So that is called as Arkapatra Sveda. It is used in extreme kapha dominant conditions. So this is useful, especially in case of Pitta Prakriti person, it should not be used. In case of kapha dominant and Vata dominant condition, the Prakriti person and kapha dominant condition, this can be utilized. Masha Pinda Sveda, Mamsa Pinda Sveda, they are the extreme Stigdha Svedas which are utilized in case of Ardita and Kukuta and Sveda, especially in Marmabhigata conditions, can be utilized. And Ushma Sveda, in that condition, the Nadi Sveda and Kshirodhuma. Kshirodhuma in traditional practice, it is a Dashamula Kshirodhuma which is being used. Also, you can also plan for the Yerandamula Kshira Dhuma as well as the Balamura Kshirodhuma, and similarly, Nilgundi Kvata and all those things also can be utilized for this Dashamula Kvata also, especially based on the need. So it is not that every case, whatever comes to mind, that has to be utilized. But the thing is that the Nadi Sweda, purpose of the Ekanga Sweda, and which dosha is involved, based on that can be done. And a variety of the different Sweda, like Panasapatra Sweda, where application of oil is done over the Panasapatra, and then it is been subjected to some sort of heat, and then the same patra is applied over the affected part. This is found to be very, very beneficial because it is a stick variety of this Vedana. And Upana Sweda, already we have discussed about Shiru Upanaha. Mukha Upanaha also is not wrong in doing Mukha Upanaha, especially in case of, because in future slides we'll discuss about the taping methods, where you will understand that some sort of the bandaging techniques and some sort of the taping techniques will improve the functioning of muscles. So in that way, Prana also can be done. Dravasveda, especially in case of Kapha dominant, Pitta dominant condition, Kapha Vata condition, where Pitta is also dominant, like in case of the Sarpa and Daha, Raga, these conditions are there. Parisheka Sveda with the Kshira, Kashaya, it can be done. Now there are different varieties of the Shamanaushadis, also very important, and especially I do prefer most of the conditions. I do prefer the Rasaushadis, and these Rasaushadis are very wonderfully working. And Swarnamakshik Basma and Swarna Basma and Rasasindura, especially Rasasindura is a Yogavahi, and whenever it is mixed with the other variety of the medication, an example is that when you take the Balamula Churna along with Rasasindura, the action is different. Ashwagandha Churna with the Swarnamakshi Basma and the Rasasindura with the Abraka Basma, that also the action is wonderful in conditions where the Ushnavirya drug has to be administered. Brahatvat Chintamani Rasa, of course, in the Palashruti, you know that whenever the Anupana is changed, the action is of this Brahatvat Chintamani also changes. And the Ekangavir Rasa, it is a Kapavata dominant condition, can be given, and Vata Vijankusha Rasa, it is a Sannipatsya variety of drug. The condition can be administered. Samira Pannaga Rasa, which is a arsenic compound, especially the Kapha and Vata dominant conditions, can be administered. And Vata Mahavata Vidvamsa Rasa with Jayapala, so it comes as a post Shuddhi. At the same time, it is also the find Vata dominant condition. Nityananda Rasa, especially indicated in case of Vatarakta dominant condition. So this also, whenever the Vatarakta kind of presentations, involvement of Rakta is there, Pitta is there, in that condition can be utilized. Chandrakala Rasa, especially the Dahayukta conditions are there. In those conditions, Chandrakala Rasa is very much essential, and it is imperative. And Rasa Raja Rasa, it is also Nadi Dorbalya, it is being considered as one of the very important prescription in these conditions. Ashtaushadis, for that matter, very important one, the household thing. Sometimes the patient may laugh at what sort of medication you give. It is a Rasona. And Rasona Pindi, which has been explained in the Vishaj Ratnavadi, where he says that Rasona Pindi, along with the Pipali Churna and Erandamula Kashaya, which is administered, is very, very, very beneficial. And I do generally prefer, in case whoever can tolerate, especially in case of Pitta, Kapha Prakriti and Vata dominant Prakritis are there. Rasona Pindi is one of the very important prescription of mine, and this is very beneficial. And Rasona is also utilized in conditions where extreme Kapha dominant conditions are there. At the same time, the Avarana condition also there. Those conditions, definitely this is found to be very, very beneficial. And then the Lashuna along with the Navanita also can be administered in case of Vata dominant condition, because it is very important, the prescription. Bala Rasayana. So now Bala in the form of Rasayana, Ashwagandha in the form of Rasayana. Is a Churna also can be administered, and especially the difference between these Bala Rasayana and Ashwagandha Rasayana is that Bala Rasayana is a Shita Vidya, and it is a Palya kind of Rasayana, and Ashwagandha is a Ushna Vidya, and it is a Vatahara. It is a Rasayana Naimitika Rasayana, Dhanadhanayana Kashayam and Shtavashtava Kashayam, especially in condition where Kapha dominant condition is there. In those conditions, this has been explained. And Bhadradarvadi Kashayam in case of Vata dominant condition, Manjishtari Kashayam in case of Pitta dominant condition, Bana Pulapanarnavadi in case of the Pitta and the Kapha dominant condition, those conditions, Shota condition also this has been utilized. And then Pasarinyadi Kashayam, specifically in case of Vata dominant condition, Balarishtam. Arishta and Kashayam, definitely there is a difference between the utilization of Arishta and Kashayam. Arishta preparations are having amla dominance, and it is Ushnatikshna Sukshma Vivai Vikasi Guna is there. So the utilization of this, the Arishtas are very, very much important and very good. Apart from that, you can plan for facial exercise, mirror exercise, facial exercise, and all those different varieties of exercise which are very, very important. And you can see that there are researches, various researches are conducted on the role of Kabat rehabilitation in facial nerve paralysis and randomized study to severe cases of the Bell's palsy. So these kind of exercise, absolutely they are very good, and that has to be utilized. This is an example how the Kabat's exercise. Please go through all this. The researches and also stimulation, muscle stimulation, stimulations are also being helpful and effective of this. This is one of the things what I said, and I did practice and I do practice with this. The effectiveness of kinesio taping on peripheral facial paralysis. So it is element kind of facial paralysis. This is going to be very, very, very beneficial. So in this kind, the taping is being done with the, which will help support the muscle, and ultimately it will help in a recovery. It is not, of course, this is not a substitution to that of the exercise therapy, but the thing is that continuously giving the support, definitely it will help increasing its function. So nowadays you are also getting this Bell's palsy splint, which is also very important to hold complete Bell's palsy conditions that can be utilized. And thus now at the end, we have come to the end of the presentation where how exactly you have to come to a conclusion and how exactly you can plan for the treatment. First and foremost is assess the patient, understand the pathology and involvement of dosha. And in case of both the condition, after understanding the pathology and the involvement of dosha, you need to ask the patient to avoid nidana. It's a very, very important one, because most of the times patients do continue their own nidana, like taking ice cream and sitting in the AC room. This is absolutely not acceptable, and taking the treatment will not have any of the improvement. Plan treatment based on samprapti and incorporate exercise therapy and taping, etc. I would understand it as improvement of chalaguna, because it has been lost. So that's the reason why sthiraguna is more. That's the reason why you have to improve, give exercise, and the taping and other kind of the exercise is very much essential, and prescribe oral medication appropriate to dosha and samprapti, and assess the patient at the end of treatment. So when you plan for the treatment for some time, what I understand, what I have seen practically is that most of the cases of idiopathic Bell's palsy, those people do recover very fast. And if they report to the physician very early in the stage of the disorder, that is very beneficial. And I've seen that within 15 days, you can do wonders in many of the cases. But the thing is that they do not come, they waste their time, they go to different neurosurgeons. And of course, that is also from their protocol, that is right. We cannot say it is wrong. But the thing is that their protocol says that. But the thing is that those people, there is one more observation, is that those people who have received corticosteroid, who has come to our stage, and they have also recovered very well. So when there are people who underwent everything, after 2 months, 3 months, 6 months, no improvement has been done. In that condition, it is actually found to be little difficult, but there are people who have recovered very well. So ultimately, what I would like to say is that early the patient comes, early the patient reports, the better will be the treatment, and better will be the outcome. So ultimately, at the end of treatment, you plan for 7 days of treatment, you plan for 15 days of treatment. At the end, you have to assess the patient and follow up the patient for 15 days with the Shiropichu and Pratimarshanasya as a follow-up treatment along with oral medication. I would say that is very key for your success. Again, I would like to say that it is 1 ml, not the 2 drops or 1 drop, 3 drops, 4 drops. Nothing is going to happen with that. Whenever you are planning for the Pratimarshanasya with the Taila 1 bindu is equal to 0.5 ml approximately, and it is 1 ml. That is what we are going to plan. So it is a Pratimarshanasya with 1 ml and Shiropichu, especially because it is feasible and it is practically it is utilized without much trouble. That's the reason why that can be utilized. And then at the end of 15 days, you find that mild to moderate or market recovery is there, continue treatment till complete recovery. So it is actually, that is the protocol, and no recovery is there. It's also very important alarming sign. Though you have not identified your the causes and all those things, if you have not assessed properly, at the end, at least after 15 days, try to understand that this probably it is not going to recover, and refer to higher neuro center or investigate for pathology of carcinoma or trauma or whatever. The things are there that has to be done. So this is how the treatment protocol can be planned. Especially what the research says is that evaluation of factors associated with that of favorable outcome in adult with Bell's palsy. They have also made a very clear version is that the rate of favorable outcome HB grade, what we have saw that the House-Brackman grade of the assessment of facial paralysis. So that is less than 2, patient recovery will be more than 80.6%. So you need not get dejected when the patient comes with a 4th grade, 5th grade, or 6th grade. So market improvement is not it is not miraculous. So it requires lots of effort, lots of patience, and lots of persistent treatment and persistent kind of the medications and the follow-up is very much essential in those conditions. That's the reason why I would say that correct diagnosis, perfect selection of medicines, and flawless execution of treatment are the key for success of the treatment in conditions of Ardita. And this is what is about the overall, the comprehensive understanding of the Ardita and its line of management, the gross understanding of how exactly you can plan for the treatment, and how to restrict yourself or withdraw yourself in conditions where it is not exactly treated by Ayurveda. Some conditions like trauma, some conditions of carcinoma, it is going to be quite difficult. So that's the reason why I would say that this is what you need to plan for. So I would say that this is how the treatment has to be planned, and you can get the success. Thank you for patient hearing. Any questions are there, I would be happy to answer.
Thank you very much, sir, for the insights and the guidance that you provided on your experiences on managing Ardita. We'll now move ahead to the question and answer session. Shall we begin, sir?
Yeah.
Delegates, if you have any questions, kindly post it in the chat box. Delegates, kindly post your questions in the chat box. Sir, our first question is how to address trigeminal neuralgia.
This is totally out of my topic, but the thing is that let's discuss about this trigeminal neuralgia. So there is actually the trigeminal neuralgia is one of the very important neurological disease where the pain is very much persistent, and that need to be treated very utmost careful. At the same time, you have to plan for the pain management as well. For this, I would say that there are two important things that you have to think. One is the necessary treatment, because in the pharmacology of this administration of nasal administration of drug, and it is the absorption. If you see, the absorption is through the trigeminal branches as well, and also it can be absorbed through the pathways near to that of trigeminal nerve, and thus it is going to be very beneficial as far as the pain management is concerned. Second thing is that about the pain management, the medications, especially the drugs related to, are very much useful for the Vedana Stapana Gana. I would say that the Kupilu preparations. Kupilu preparation, when I speak, there are different varieties of Kupilu preparations are there. One is Vishatindukavati, one is Navajivana Rasa, and Charak Palms is new, that is also contains this one, and Agni Tundivati. So the proportion of this, the Kupilu preparation, Kupilu, is very, that has to be very carefully selected based on the intensity of pain. Apart from that, disease modifying, this is a symptomatic management. Disease modifying management could be the administration of the disease modifying drugs like Brahatvat Chintamnivasa. Along with that, you can plan for the Prasarini Kashayam or the Maharaja Prasarini Thailam internal administration, as well as continuously, if the course is finished, then you can plan for these kind of the Pratimarshanasya, that also will help to address this condition.